What are the best treatments for radiation-induced blood in urine? Imagine dealing with blood in your urine after cancer treatment. It can be unsettling, but understanding the options can help you feel more in control. Radiation cystitis is a common side effect of pelvic radiation therapy, especially for cancers like prostate, bladder, cervical, or rectal cancer. It can cause bleeding that ranges from mild to severe. The good news is that many treatments are available, and they are tailored to how serious your symptoms are. The first step in managing blood in urine from radiation cystitis is to stabilize your condition. This might mean getting fluids through an intravenous line to prevent dehydration and help flush out the bladder. If you are losing a lot of blood, a blood transfusion could be necessary to restore your red blood cell levels. To prevent blockages from blood clots, your doctor might perform bladder irrigation using a catheter to gently wash out the blood and debris. For mild cases, conservative treatments often do the trick. Over-the-counter pain relievers can help ease discomfort, and anti-inflammatory drugs like non-steroidal anti-inflammatory medications may reduce swelling and irritation. Sometimes, alkalizing your urine with specific medications can lessen bladder irritation and improve symptoms. When bleeding persists or becomes moderate, doctors may use medications or direct bladder treatments. Hemostatic drugs can help control bleeding, and bladder installations are common. These involve placing medications directly into the bladder through a catheter. For severe bleeding, formalin solutions at low concentrations are sometimes used, but they must be administered carefully to avoid damaging the bladder or ureters. Other agents like aluminum compounds, placental extracts, or prostaglandins may be used in certain cases. Products like sodium hyaluronate, sold under brand names like Cystitis, can help rebuild the bladder's protective lining and reduce irritation. If bleeding is very severe or does not respond to initial treatments, more advanced procedures might be needed. Cystoscopy, which involves inserting a thin tube into the bladder, can be used to identify bleeding sites. Laser therapy or electrocoagulation can then be applied to stop bleeding from specific areas. In some cases, reducing blood flow to the bladder through procedures like embolization of the internal iliac arteries can help control bleeding. Hyperbaric oxygen therapy is another option. It involves breathing pure oxygen in a pressurized chamber to promote healing of damaged bladder tissue. This treatment has been shown to be safe and effective, especially when other therapies fail. In the most extreme cases, when bleeding threatens your life and other options have been exhausted, surgery might be considered. This could involve removing the bladder entirely, known as cystectomy, or creating a urinary diversion, such as a new passage for urine using part of your intestine. These are last resort options and are only considered after careful evaluation. Every treatment plan should be personalized. Your healthcare team will consider the severity of your bleeding, your overall health, and previous treatments. It is also important to rule out other causes of blood in urine, like infections or bladder cancer, before focusing on radiation cystitis. Close monitoring is essential so that your treatment can be adjusted as needed and to manage any side effects. In summary, managing blood in urine caused by radiation involves a step-by-step approach. Starting with supportive care like fluids and pain relief, moving to medications and bladder installations for moderate cases, and progressing to advanced procedures or surgery if necessary. Always work closely with your healthcare provider to find the safest and most effective treatment for your specific situation. Remember, each person's experience is unique, and professional guidance is key to recovery.